Digestive system. Questions 2. 9. A nurse is caring for a client who has subtotal gastrectomy. The nurse assesses the client for which signs and symptoms of dumping syndrome. 1. Abdominal pain, elevated temperature and weakness. 2. Fever, constipation and rectal bleeding. 3. Diarrhea, chills and hiccups. 4. Weakness, diaphoresis and diarrhea. The correct answer is 4. Weakness, diaphoresis and diarrhea. 10. The nurse is evaluating the plan of care for a client with peptic ulcer disease with a nursing diagnosis of acute pain. The nurse would determine that the client has not met the unexpected outcomes if the client states 1. The pain is relieved with histamine H2 receptor antagonist. 2. The irritating foods have been eliminated from the diet. 3. The client is being awakened at 2 a.m. with heartburn. 4. The client has absence of pain before meals. The correct answer is 3. The client is being awakened at 2 a.m. with heartburn. 11. The nurse is performing an abdominal assessment on a client. The nurse determines that which of the following findings should be reported to the physician. 1. Concave midline umbilicus. 2. Pulsation between the umbilicus and pubis. 3. Bowel sound frequency of 15 sounds per minute. 4. Absence of brood. The correct answer is 2. Pulsation between the umbilicus and pubis. 12. A nurse is caring for a client who has just returned from the operating room following the creation of colostomy. The nurse is assessing the drainage in the punch attached to the site where the colostomy was formed and notes the serosineous drainage. Which nursing action is most appropriate based on this assessment? 1. Notify the physician. 2. Document the amount of characteristic of the drainage. 3. Apply ice the stoma site. 4. Apply pressure to the stoma site. The correct answer is 2. Document the amount of characteristic of the drainage. 13. The nurse is teaching the client about an upcoming colonoscopy procedure. The nurse would include in the instruction that the client will be placed in which of the following position for the procedure. 1. Left sims. 2. Right sims. 3. Knee chest. 4. lithotomy. The correct answer is 1. Left sims. 14. A client is seen by the ambulating care clinic has ascites and slight jaundice. The nurse assesses the client for a history of chronic use of which of the following medications? 1. Acetaminophen. 2. Acetylsalicylic acid. 3. Ibuprofen. 4. Ranitidine. The correct answer is 1. Acetaminophen. 15. The client being seen in the physician office that has just been scheduled for a barium swallow the next day. The nurse writes down which of the following instruction for the client to follow before the test. 1. Fast for 8 hours before the test. 2. Eat a regular supper and breakfast. 3. Continue to take all oral medication as scheduled. 4. Monitor own bowel movement pattern for constipation. The correct answer is 1. Fast for 8 hours before the test.